So let's start with the Miss America controversy. Take a look.
The 89th annual Miss America pageant, held last week, featured unique women from all 50 states. But one contestant stood out from the rest.
Miss Colorado!
During the talent portion of the competition, donning scrubs and a stethoscope, Colorado's Kelley Johnson, a nurse by profession, spoke movingly about a patient who inspired her.
Every nurse has a patient that reminds them why they became a nurse in the first place. Mine was Joe. Joe was in the beginning stages of Alzheimer's. He'd ask me if I could change his treatments, and I'd say, "No, Joe, I can't do that, I'm just a nurse." "Well, what about my medications? Can you fix those?" And I'd say, "No, Joe, I can't, I'm just a nurse." But one night, everything changed. I found him in his room crying, and I lifted his head up out of his hands, and I said, "Joe, I know that this is really hard, but you are not just Alzheimer's. You are still Joe." And he looked right back at me, almost to look through me, and said, "Nurse Kelley, then the same goes for you. Although you say it all the time, you are not just a nurse. You are my nurse, and you have changed my life because you've cared about me." And Joe reminded me that day that I'm a lifesaver. I'm never going to be just a nurse.
Kelley's monologue has now been viewed on YouTube nearly 5 million times. Surprisingly, it was also greeted with a few highly visible negative comments in the media when it was questioned why Kelley, as a nurse, had a stethoscope. That in turn sparked a campaign in social media that took the web by storm. Nurses all around the country began sharing photos of themselves on Facebook and Instagram wearing their scrubs and stethoscopes, hashtagging not just a nurse, nurses unite, and my talent is nursing. One nurse, who goes by @NurseEyeRoll, was particularly moved by Kelley's performance and shared her thoughts with her nearly 16,000 followers.
I saw Miss Colorado's monologue. I thought it really represented nursing in a really positive way, and I walked away from seeing that clip just really proud to be a nurse.
The posts went viral, as did the news coverage.
Miss America contestant who chose nursing as her talent.
You did a monologue, you're a nurse.
Thanks to Miss Colorado, nurses everywhere have spoken. It might be time we start listening.
Please welcome Miss Colorado Kelley Johnson. I mean, they really love you.
Hi, guys.
Please have a seat.
Thank you.
I knew they'd be emotional to see you. That's.
I'm emotional to see them. This is amazing. Thank you all so much for coming.
So I was really struck by the story you told in the monologue.
Yeah.
And you titled it Just a Nurse. In fact, not just a nurse.
Right.
So why'd you pick that title? What did that mean to you?
Yeah, so when I first started thinking about what talent I was going to do on the Miss America stage, I don't know how to sing, I don't know how to baton twirl, I don't know how to do those wonderful technical talents. I just don't know how, but I didn't want to be counted out of the job of Miss America because I knew that my talent was nursing. I knew that I cared about people. I knew that I had something intelligent to contribute to the conversation about healthcare as a contender for Miss America. And so when I started thinking about what I was going to do for my monologue, I thought, I can go dramatic, I can act, I can do something like that, or I can just simply be myself. I can be Kelley and I can speak from the heart about someone who made a difference in my life. And the reaction and how much it's done for the nursing profession, the women who've been in this profession for so much longer than me, the experienced nurses, the nurses who are taking care of our soldiers, the nurses who are taking care of our kiddos and our babies, and the nurses that are there for you when you go through your last cancer treatment. Those are the nurses that deserve this recognition. And I cannot believe that me just making one choice has given them what they deserve.
And they do deserve it. I've been following some of the controversy, some of the criticism that you faced. Did that surprise you?
I was a little surprised, but I did not even know about the comments until all of these wonderful women and the rest of the nurses in America reacted to it for me. And it was just, I was just so excited about what it was doing for nurses in general and for the recognition that they all deserve.
Let's talk about the stethoscope. You're wearing one now.
Yeah.
It became part of this discussion.
Right.
And folks were saying, well, why are nurses wearing stethoscopes? That catch you off guard?
That did catch me off guard. You know, nurses are so intelligent. We're so educated. We've gone through so much with our doctors and with with our patients, and we joke about times that doctors have needed to borrow our stethoscopes, and so yeah.
You know what I say? As soon as I heard the controversy, I tweeted out, because I am known, renowned, where I practice, always borrowing nurses. First of all, they're clean.
Right.
You always
Absolutely.
They work.
Yes.
And you always have one.
Right, and so it's actually been a blessing in disguise, because so many people now are talking about how much we do and how educated we are and how much we care and really how serious our job is and how hard we have to work. I mean, 12-hour shifts, we're going without eating, without using the bathroom to care for people and to take care of people. We're there with our stethoscopes, auscultating and making critical judgments and critical thinking for ourselves, and then calling your doctor. And it was a wonderful opportunity to show how educated and how smart and how intelligent you have to be a nurse.
I was really impressed at how many nurses, others as well, but especially nurses, got behind you on social media.
Yeah.
And I know you follow some of this, but a lot of them were sporting stethoscopes.
Right.
Very proudly saying the things that you're saying right now. When you see this outpouring of emotion from the nurses community, it becomes evident that there was a nerve that was struck.
Right.
Are nurses underappreciated?
Absolutely, I do believe so, and I don't think so anymore. You know, I think that there are so many people who do thank their nurses and do appreciate their nurses, but I believe that just because there were some that maybe didn't know what we did or didn't know really how hard this job is and how hard you have to work to be a good nurse.
See, I think this is a symbol of how we change opinions in general.
Right.
And when we're uninformed about something, by the way, nurses are the #1 most respected profession. They are. That's actually data.
Yes.
But when we take opportunities like this and get, and take the tools that you've given us now to educate folks in a way that's completely unique, it changes all of our lives. So let me bring in a woman who's part of this movement, the hashtag Nurses Unite movement, which I gotta say was it reached about 60 million people.
That's so cool.
And one of the first to use it was Jamie Otis. A lot of you know her. Come on over, Jamie. Jamie actually practiced at my hospital, New York Presbyterian.
Hi, nice to see you.
So, can I just share this tweet from you?
Yeah,
it's one of the first ones I read.
Sure.
It's a picture. You say, what's my talent? I'm a nurse. My stethoscope is in my locker. That's explaining, of course, why you're not wearing it then. So, what have you been hearing from folks? Educate us a little bit about what's going on in social media around this.
Social media, Instagram, Twitter, Facebook is angry, and it's largely because I think that there's this hidden message behind the stethoscope comment, is that, a larger part of America is still a little undereducated about our job. And the reason why everyone got so angry on social media is because it's like there's this hidden message that we don't feel appreciated. There are so many times that we're working our tails off, as all you ladies know, and we don't get, it just seems like we don't get a thank you, or it's, oh, that's just the nurse, so let me wait until, and it's like, wait a minute, I can help you out. I know what I'm doing here. So I think that that's a hidden message. And honestly, Dr. Oz, seriously, thank you for giving us a platform and thank you for...
Thank you, Jamie.
No, thank you.
So, I feel passionate about doing this because a lot of times I know you'll be slaving over a patient's bed all night long. The family will come in, they'll see you working there, then they'll come ask me what to do about something that you were treating all night long. Right. And then I'll go and ask you, the nurses, what do you think I should say? Right? I mean, we've all been there. And I say it with great pride. I'm not embarrassed. I've got someone really smart taking care of somebody. I want to get all that advice. That's what a good doctor should do.
I love you for that.
So I've got an audience full of nurses who got something to say about it. Who wants to go first? Put your hands up. Excited? You would go? Go ahead.
Good morning. Thank you again, Dr. Oz, for having this platform for nurses. I represent the New Jersey State Nurses and the American Nurses Association as a state president. The largest professional nursing association in America. We're the voice for the 3.4 million registered nurses out there. We are so proud of you, Kelly. Every time I hear your monologue, I start to tear up, because even when they started showing it before you came out, I was like, okay, I'm getting teary-eyed again. Because it's those moments when we have with our patients that you're like, wow, that is why I did this. This is why I do what I love. I have been a nurse for 30 years, an oncology nurse. So you have those touching moments where you're like, okay, I can get through today. I helped someone today.
You got to be reminded about that.
And we have to be reminded sometimes. And the thing that most people, the biggest myth is that we are licensed, highly educated professionals. We have the rights and we have the regulations in place that allow us to do our jobs, take care of our communities, take care of our patients, and do it very effectively, try to keep the costs down, and move healthcare forward. So when those comments came out from The View, I was really taken back. As an avid watcher of The View and have highly respect for them, I was actually taken back by the comments that it's a doctor's stethoscope. It just like downplayed the whole profession of nursing with just one little comment. And I think that's why we're taken back.
See, first of all, I love your comments, and I love that you're emotional about them.
Yeah.
I see the tears coming off the side here. Because nurses, they care a lot. I really think it's mostly about being uninformed. That's what it comes down to. And the reason this is a huge opportunity for us.
This is so teachable moment.
Exactly.
This is such a teachable moment.
Yeah. Let's get across what you know to be true, but so many folks don't. You're not just the hired help popping in once in a while. You're the backbone of the structure.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.